Have you been treating yourself for vertigo? Is it actually making you feel worse and not giving you the results you were hoping for? This is a common complaint that I hear from people I meet if they've looked up online and maybe Googled vertigo treatments at home. They found some videos on YouTube that instruct how to treat yourself for vertigo, and they just kind of went for it and just decided to try to treat themselves without having an evaluation by a professional. Or if the patient actually did seek out professional medical care, but the healthcare provider just handed them a sheet with instructions and said, go try this at home. Frequently, that will be the Epley maneuver or the Brandt-Daroff maneuver that may be given out to patients to try at home by a healthcare provider without actually going through and training the patient on how to do these home maneuvers properly, and perhaps without even thoroughly evaluating the root cause of the vertigo. Treating yourself for vertigo can make it worse due to unexpected treatment complications that may occur during BPPV home maneuvers. This is why I don't recommend for you to treat yourself for vertigo without having a professional evaluation. I highly recommend for patients to either be supervised or instructed by a professional that knows how to treat vertigo. We're going to get into that in a minute. But first, I am the vertigo detective, Kim Bell. I'm a licensed physical therapist, and this channel exists to give education, information, and hope to people suffering with dizziness and vertigo. This is for educational purposes only. This is not individual medical advice. Now, in order to treat BPPV, which is the most common cause of vertigo from the inner ear crystals, I have a lot of other videos on this topic, which you can find on this channel. These are the inner ear crystals that somehow became loose, become dislodged and displaced in the ear, and then they cause vertigo spells, typically when you move your head around, when you lie down, roll over, look up, bend down. All these different positions and motions can cause vertigo from these inner ear crystals. And it is actually fairly easy to resolve with the proper evaluation, the proper skill set, the proper knowledge level, and the proper treatment. However, in order to effectively treat BPPV crystals, you have to know which ear is affected. We've got the right ear and the left ear. Within each ear, there are 3 canals that could possibly have BPPV. We have the anterior canal, which is also called the superior canal. We have the posterior canal, which is also called the inferior canal. And then we have the horizontal canal, which is also called the lateral canal. So we have 3 canals in both ears. And then within this set of canals, the crystals can be spread out into all different types of places. As far as I've observed, they can be in about 12 locations within each set of canals. So therefore, 24 total locations, I might find crystals when I evaluate a patient with BPPV. So you need to know which ear to treat. You would need to know which canal to treat. You would need to know which maneuver is appropriate for that type of ear crystals and how to do the maneuver correctly. The maneuvers really rely on precision and accuracy. You have to have the angles correct, the timing should be fairly correct, and how to move through the maneuver without any extraneous motions is very important. This can only really be determined by a professional. Even so, even if you know which ear to treat, which canal to treat, which maneuver to do for your type of BPPV, and how to do the maneuver correctly because you were supervised or instructed by a professional after an evaluation, even with all that in place, which is the only time that I do suggest for my patients to treat themselves at home for BPPV, is after evaluation, after instruction, after we practice together, and they know for sure how to do the maneuvers correctly. Even so, BPPV complications can and do occur occasionally during maneuvers. This can cause confusion for patients who are trying to treat themselves and can make you feel worse. That's what we're going to get into in detail in this video. What type of complications might arise that make me not recommend for you to try to treat yourself? First of all, you can have an atypical type of vertigo. So many patients who have looked on YouTube to try to figure out how to treat themselves have found a video that purports to tell you which ear is affected. It may tell you, turn your head this way, lie down this way. And if you get dizzy, oh, that means it's this particular ear that is affected. And that's the side you should be treating for BPPV. However, I will tell you that people can have atypical crystals, which means that the vertigo would actually show up on the opposite side if the crystals are in an unusual location. So not the typical, but the atypical type of crystals. And I'll just give you one example of this. There's a condition called apogeotropic posterior canal BPPV. Typically, the vertigo is going to be worse on the unaffected side. And that goes against what these basic videos are telling you online about how to determine the affected ear. And so therefore, you could do maneuvers on what you think is the affected ear forever and never resolve the problem, but just make yourself sick frequently and continuously while you're going through all these maneuvers. So, I mean, the maneuvers for vertigo can make you feel sick even if they are effective, but we want to make sure there's a therapeutic value and a benefit to basically putting yourself through this kind of torture if you have vertigo. Now, another complication that can arise is what's called an ipsicanal switch. And this is when the crystals actually switch locations within the canal that you're treating in the middle of the treatment. And that actually changes when you get the vertigo. It can change what position you're in when you feel it. And it can actually change and reverse the direction of your eyes if your eyes are bouncing around due to the vertigo. And it can cause a lot of confusion for novice clinicians and people who are trying to treat themselves at home. So an ipsicanal switch is something that professionals who specialize in treating BPPV are always alert for and always ready to respond to when they're treating you through professional healthcare services. Another consideration is sometimes patients have crystals in more than one canal. So that's called multi-canal BPPV. That would be within one ear, the right ear or the left ear. You can have crystals spread out in more than one canal. The best way that I can sort of explain this to you is if you come back from the beach with sand on your feet and you walk through the kitchen and then you also walk through the living room and then you also walk through the bathroom. Now you've got sand in 3 different rooms of your house. Okay, and so that can happen within one ear where you can have multi-canal BPPV within an ear. And then you really need a professional with eyes on you to continually assess you as you're getting treated in case the next canal shows up, and then a different treatment would actually be needed. Some patients also have crystals loose in both ears. So therefore, the right ear and the left ear might need treatment. This is not so easy to determine on your own. It's much more easy for a professional to determine with professional testing and evaluation of your eye movement during the testing. Frequently, patients who have hit their head, had a concussion, some kind of a head bonk preceding the vertigo may have bilateral crystals, meaning crystals loose in both ears. And that makes it very hard to try to treat yourself for vertigo. That's another reason why I don't recommend it. An additional reason I don't recommend to treat yourself for vertigo is that if you don't do the treatment correctly, and mark my words here, if you don't do the treatment correctly, you can actually convert the crystals from the canal they were in originally into another canal. And that's called a canal conversion. And the most common thing I see with this, if people are trying to do Epleys at home on their own without proper instruction, and they don't do the Epley correctly, they don't sit up correctly from an Epley maneuver, then the crystals can convert into the horizontal canal on that side and therefore cause different symptoms, but very similar. It's still vertigo, it just feels a little different, and that will never be cleared by Epley maneuvers now because the crystals are in a different canal. So that would be called a canal conversion, which is the crystals actually switch to a different canal. They convert to a different canal within the same ear in the middle of a treatment session if you don't do the maneuver correctly. Now, sometimes this can happen even if the maneuvers are done correctly, but I would say if the maneuvers are done correctly, it would be more likely that the patient had multi-canal BPPV to begin with than converting the crystals during a proper maneuver. Frequently, the way the crystals convert to a new canal is due to improper technique. Another reason why I don't recommend for you to treat yourself for vertigo is because sometimes the crystals can be stuck. This is called cupulolithiasis. It's an unusual or less common type of BPPV, but the crystals can actually be stuck. And therefore, you can roll through these maneuvers forever and potentially never solve the problem. Finally, one of the worst things I think that can happen if you're treating yourself for vertigo without professional supervision or adequate instruction, or on your own, just watching videos at home, is the crystals can rarely, but it can happen, get jammed. And so this is actually called a canal jam. It's sort of like, think of like if your toilet got clogged or your sink got stopped up, right? Where it's just a jam and now nothing can pass through. And so when that happens, it's unusual, it's not common, but it does happen rarely and occasionally. But when that happens, when the patient sets up from the maneuver, they will just be continuously spinning until or unless somebody reverses the maneuver. So you have to actually roll back through the maneuver backwards in order to unclog or unjam the canal. And that can happen if the crystals are bigger, if they're in a little cluster. They just happen to get jammed in a narrow part of the canal in the inner ear. So these are all different reasons why I don't recommend treating yourself for vertigo. It's possible you can get a complication, which would make it confusing. It could make you feel worse. And the other thing is, there are other conditions that can cause positional vertigo besides BPPV. So therefore, it's really important to have a professional assess you to make sure you actually have the ear crystals, BPPV, and not some other condition that can cause positional vertigo and mimic BPPV, because that may need a whole different treatment plan.